I move that leave be granted to introduce a bill entitled The Treatment of Cancer Advertisements Bill to provide greater protection for patients who receive a cancer diagnosis and then are inundated by people trying to sell them treatments or claims of cures in their most vulnerable moments. The origins of this bill lie in the concerns of the cancer care community. There is a growing concern amongst clinicians who see the effects of false claims due to lack of regulation in this area. There are not adequate safeguards against unproven and at times dangerous cures or treatments being pushed upon people who receive a cancer diagnosis. The bill is about being able to prosecute people who are making large sums of money by peddling things that they claim can cure cancer when there is no evidence to support those claims. These people are selling treatments that at best have no effect whatsoever and at worst increase pain, suffering and often hasten death. The patient will not be the one found at fault here, but rather the people who profiteer from promoting products of dubious or dangerous composition or efficacy. Anyone who is advertising a treatment or therapy that has been proven effective will be exempt from prosecution under the bill. Likewise, doctors and nurses, etc., working in the field of oncology or cancer care will be exempt. Similarly, patients' access to clinical trials will not be affected, nor will emerging research and studies in the field of cancer research, clinical care or treatment. Many medical professionals have been calling on this for some time, as they see their patients pursuing pathways that can seriously interfere with their medical treatments. There is no end to the sad and frightening stories that oncologists, nurses, families, patients and dietitians working in this area can tell us. RTE's Prime Time with Conor Wilson did great work exposing some of these practices in a special show they aired some weeks ago. An excellent example of truly public service broadcasting, though with a deeply upsetting narrative. It is for the people we may know who are going through cancer treatment at the moment and the people who we have lost that this bill is for. I urge the opposition to get behind it and to support the bill, and I thank the Ceann Comhairle for giving me the opportunity to introduce this.
I just wanted to express my strong support for this private member's bill being put forward by Deputy O'Connell. We've seen enormous improvements in cancer care in Ireland over the past few decades, to the extent that more people now survive cancer than die from it, and it'll improve all the time with improved screening and prevention and improvements to our cancer care centres. But I share the real concern that so many people who have cancer, who are sick with cancer, are being exploited by people who would offer cures that don't work, treatments that don't work, and various other false health claims, and do so for profit and abuse immensely vulnerable people. So I think this legislation is timely, and I very much welcome that it's gone to first stage today.